what are your thoughts on the current telehospitalist landscape in the US?
I mean, I think it's certainly a evolving field, and I think it really is. There's a lot of potential there to utilize it to help address the challenges we continue to have in the workforce and managing staffing shortages, whether it be with physicians or APPs in the hospitalist setting. And I think there's definitely a role that telehospitalists can play in the care of the patient. And I think part of the challenge is defining that role well and defining what can be done via remote services versus what needs to be done in person, and understanding that it doesn't have to be an all or none phenomenon, right? So that I think the role of telehospitalist is really incorporating that role within your in-person hospitalist program that you have within your organization and defining how that's going to work. So what are the parameters around which you utilize telehospitalist services? You know, is it for cross coverage? Is it for sort of routine conversations that you may need to have with consultants? You know, simple patient evaluations, and then understanding at what point you need to bring in an in-person physician or provider to manage that patient from there. And I think as we start developing those processes and parameters more clearly, I think that we'll likely see some increase in the utilization of telehospitalist services within organizations.
Absolutely, absolutely. And that is an organic process, as you said, the more needs there are, the more people start thinking about, how can we sort of solve this continuous problem that they're facing.